Hello everybody, this is Dr. Perlstein again, and we're going to be discussing something that I commonly see and people really neglect, and that is actually a sprain of the foot. So they can be doing this when they're actually just simply walking, stepping in a little hole in the sidewalk, actually even going down the steps in their house, or actually just doing some sports activity, or even just going to a wedding and actually falling or twisting your foot a little bit, or even having somebody actually step on you. Don't neglect this problem. You're starting to limp, it's getting all swollen, it's really hurting you, and you just can't put on your shoe and you don't know what to do. Well, people go to their internist and sometimes they could actually help them, but really internists don't really look at this in the proper way. What does that mean? They don't usually use the x-ray, they don't have one, they send you someplace else to look at it. You're wasting a lot of time, you're wasting a lot of money, you're not being treated properly, and many times it needs additional stuff. What does that mean? It means you may actually need an ultrasound. An ultrasound is something different than an x-ray. We could actually see torn muscles. That's not something that you could see on an x-ray. So if you do take an x-ray because your doctor sent you there and they don't see anything, that does not mean that there's nothing there. It means that there is something there, but it was not diagnosed properly. You may need to have an ultrasound, especially if you don't have experience in treating injuries. Just looking at an x-ray does not tell you a whole lot. Get the proper treatment, get the x-rays, get the ultrasound if necessary, get it bandaged up and get it treated so that you don't have problems later on, because a neglected injury many times does not go away. It just keeps on bothering you again and again and making you all sorts of problems. Thanks again for watching. This is Dr. Perlstein.